In today's complex healthcare landscape, the ability to understand and act upon health information is critical for patients to make informed decisions about their well-being. Surprisingly, only 12% of the American population possesses proficient literacy skills. Many adults struggle with routine health tasks such as deciphering prescription labels, comprehending discharge instructions, or even locating the nearest healthcare facility. This course digs deep into the realm of the health literacy, shedding light on its significance and exploring strategies to overcome the barriers that hinder the patient's education. By empowering healthcare professionals with the knowledge and the tools to enhance health literacy, we aim to reduce acute care incidents and foster a healthier, more informed patient population. My name is Katie Chorba. I'm an Assistant Director of Quality Improvement with IPRO ESRD Network, and today we're going to look into health literacy barriers, strategies to decrease acute instances. We're going to start by assessing your population's health literacy. Health literacy is key to making informed decisions about healthcare and maintaining a healthy lifestyle. And as I stated before, about 12% of the American population has proficient health literacy skills. If many adults have a hard time completing routine health tasks like reading and understanding drug labels, discharge paperwork, or even reading the directions to the closest health center, the question comes up as to how can we as healthcare workers increase health literacy to decrease acute care incidents for our patients? At the end of this presentation, you will be able to define health literacy, gain a comprehensive understanding of what health literacy entails and why it cornerstones effective healthcare communication. Explain why health literacy is important by exploring the pivotal role health literacy plays in patient outcomes, ensuring that you grasp why it is a vital aspect of modern healthcare. Identify who has low health literacy. Learning how to identify individuals with low health literacy, enabling you to target interventions effectively. And explain the impact low health literacy has on patients. By doing this, you will be able to reveal far-reaching consequences of low health literacy on patients' lives and healthcare experiences. Explain what kind of barriers patients with low health literacy have and give strategies to mitigate low health literacy barriers. To investigate various barriers faced by patients with low health literacy and discover evidence-based strategies to mitigate these obstacles. And then to provide signs and symptom education and teaching to our patients. My goal is to help you develop skills necessary to provide a clear and accessible health education, empowering patients to manage their health effectively. So what is health literacy? Healthy People 2030 addresses both personal health literacy and organizational health literacy, and it provides the following definitions. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves or others. Whereas organizational health literacy is the degree to which organizations enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. These definitions from the health literacy definitions used prior in Healthy People 2010 and Healthy People 2020. The degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate decisions. These new definitions emphasize people's ability to use the health information rather than just understand it. Focus on the ability to make well-informed decisions rather than appropriate ones. And they incorporate a public health perspective, acknowledging that organizations have a responsibility to address health literacy. So why is health literacy important? To start off, it is a fundamental skill not only for the patient, but also for the healthcare team. Health literacy is important because it helps with informed decision making. It enables individuals to access, understand, and to evaluate health information. It empowers them to make informed decisions about their health, including in choosing appropriate treatments, understanding potential risk and benefits, and participate in shared decision making with healthcare providers. Health literate individuals are better equipped to navigate the healthcare system and to advocate for their own needs. Disease prevention and health promotion. Health literacy plays a critical role in promoting preventative behaviors and adopting a healthy lifestyle. People with high health literacy are more likely to engage in health promoting activities such as maintaining a balanced diet, exercising regularly, seeking preventative screenings, and adhering to medication regimens. They can comprehend health-related recommendations and understand the importance of early detection and timely intervention. Improved health outcomes. Adequate health literacy has been linked to improved health outcomes. When individuals understand their conditions, treatment options, and self-care instructions, they are more likely to follow through with recommendations and treatments of managing chronic conditions effectively and experience better health outcomes overall. Health literate patients are also less likely to experience medical errors and adverse events. Effective communication with healthcare providers. Health literacy facilitates effective communication between the patient and the healthcare provider. Patients who can understand and communicate their symptoms, concerns, medical history accurately are more likely to receive appropriate diagnosis and treatment. Likewise, healthcare providers who can communicate health information clearly and in a patient-centered manner can foster trust, enhance patient satisfaction, and promote adherence to treatment plans. Reduction of health disparities. Health literacy plays a role in addressing health disparities by ensuring equal access to health information and healthcare services. Limited health literacy is more prevalent among certain populations, including those with lower socioeconomic status, older adults, and individuals with limited education. By empowering health literacy, healthcare providers can contribute to reducing health disparities and promoting health equity. So why is health literacy important, and what is low health literacy linked to? Low health literacy is linked to increased visits to the emergency room, increased hospital stays, patients are less likely to follow their treatment, and they have higher mortality rates. According to the CDC, nearly 9 out of 10 Americans have limited health literacy and have struggles with understanding information related to their health. So as healthcare providers, we need to provide effective communication as it is the cornerstone of quality care. Health literacy enables patients to ask questions and to express concerns and to understand the medical advice, fostering a productive relationship between the healthcare providers and the patient. Let's dive into the demographics and the groups that are particularly vulnerable to low health literacy. While it is important to note that low health literacy can impact individuals from diverse backgrounds, several populations are at high risk. First, we have socioeconomically disadvantaged individuals. This group includes people with low socioeconomic status, limited formal education, or lower income. These factors can contribute to higher rates of low health literacy. Next on the list are older adults, especially those with limited formal education or cognitive decline. Age-related factors can sometimes lead to challenges in understanding complex information. Another group susceptible to low health literacy consists of individuals with limited English proficiency. This category encompasses individuals for whom English is not their primary language and those who may have difficulty effectively communicating in English. Immigrants and refugees, especially those who have recently arrived in the new country, face unique challenges. They may not be familiar with the healthcare system of their new home, and language barriers can intensify health literacy issues. Moving on to rural and remote communities. These areas are often limited healthcare resources and reduced access to health information. These circumstances can contribute to low health literacy rates. Lastly, individuals with limited health education may have not been exposed to sufficient health information or have experienced inadequate health education programs. This lack of fundamental knowledge can result into low health literacy. By understanding these specific groups and their potential challenges, we can better tailor our efforts to improve health literacy and ensure that healthcare information is accessible to all individuals, regardless of their backgrounds or their circumstances. On this slide, I want to share some statistics with you. Over 90 million Americans have low health literacy. 2 out of 3 older adults do not understand basic health information. And patients with lower health literacy cost 4 times as much as a patient with higher health literacy. Understanding the consequences of low health literacy is critical to appreciate the significance in healthcare. Low health literacy has various implications, including limited understanding of health information. Individuals with low health literacy struggle to grasp and interpret health information. This includes instructions from healthcare providers, medication labels, health education materials, and insurance forms. As a result, they may experience misunderstanding, confusion, and challenges in effectively managing their health. Poor health outcomes. Low health literacy is closely linked to poorer health outcomes. Individuals with limited health literacy often find it difficult to manage chronic conditions, leading to medication errors, delays or avoidance of necessary medical care, and increased rates of hospitalizations and emergency room visits. They may also be less likely to engage in preventative health practices or screenings, resulting in delayed or misdiagnoses. Health disparities. Vulnerable populations, including those with low socioeconomic status, older adults, racial and ethnic minorities, and individuals with limited education, are disproportionately affected by limited health literacy. This exacerbates health disparities, as these groups encounter obstacles in accessing and comprehending health information, ultimately resulting in disparities in health outcomes and health care utilization. Increased healthcare cost. Low health literacy can lead to higher healthcare cost. Misunderstanding, medication errors, and preventable hospitalizations contribute to unnecessary healthcare expenditures. Additionally, individuals with low health literacy may struggle to navigate the healthcare system, comprehend insurance coverage, and access appropriate care, further escalating healthcare cost. Limited patient engagement. Health literacy plays a pivotal role in fostering active patient engagement and shared decision making. Individuals with low health literacy may encounter difficulties participating in discussions with healthcare providers, posing questions, or expressing their healthcare preferences. They may also be less involved in treatment decisions, exhibit reduced satisfaction with their care, and display lower adherence to treatment plans. The burden on the healthcare providers. Healthcare providers face unique challenges when communicating with patients that have low health literacy. They must adapt their communication styles to employ plain language and offer additional support to ensure patient comprehension. This often demands extra time and resources, creating a potential burden, especially in a healthcare setting with limited resources or time constraints. Understanding these far-reaching consequences underscores the importance of addressing and improving health literacy for the benefit of individuals and the healthcare system as a whole. Low health literacy can result in a cascade of detrimental effects, profoundly influencing both individuals' well-being and the healthcare system. Medication errors. Low health literacy often leads to misunderstanding medication labels, dosages, and instructions. This increases the likelihood of medication errors, which can have a serious consequences, including adverse drug reactions and complications. Low rates of treatment compliance. Effective healthcare relies on clear and open communication between the patients and the providers. When patients struggle to comprehend medical advice or treatment plans due to health literacy, it can result in mismanagement of their conditions and low rates of treatment compliance. This communication gap hampers the achievement of therapeutic goals. Reduced use of preventative services and unnecessary ER visits. Individuals with low health literacy may not fully grasp the importance of preventative services, such as vaccinations, screening, or regular checkups. As a result, they may underutilize these services, leading to missed opportunities for early detection and prevention. Inadequate self-care knowledge can lead to health issues escalating to a point of requiring an emergency room visit. Ineffective management of chronic conditions. Managing chronic conditions such as diabetes or hypertension often necessitates ongoing self-care. Low health literacy can impede an individual's ability to comprehend and to follow self-care recommendations. This can result in suboptimal management of chronic conditions, exacerbating health problems, and increasing the burden on the healthcare system. Longer hospital stays and increased readmission risk. Patients with low health literacy may experience longer hospital stays due to difficulties in understanding post-discharge instructions and managing their health at home. Furthermore, these increased likelihood of medication errors and treatment noncompliance raises a risk of readmission shortly after their discharge. Poor responsiveness to public health emergencies. During a public health emergency, such as a disease outbreak or a natural disaster, clear and timely communication is essential. An individual with a lower health literacy may struggle to understand public health directives or emergency instructions, leading to delayed or inadequate responses, potentially putting themselves at risk. Higher mortality. Perhaps the most concerning consequence is the potential for higher mortality rates among individuals with low health literacy. Poor understanding of health conditions, delayed treatment, and difficulties in self-care can contribute to adverse health outcomes, including premature death. In summary, low health literacy is not merely a personal challenge, but it is a systematic concern with significant ramifications. Recognizing these consequences underscores the urgency of addressing health literacy to enhance an individual's health outcomes and the overall efficiency of the healthcare delivery system. Alerts of low health literacy in patients. Understanding the warning signs that a patient may have low health literacy is critical for providing effective health care. It is important to note that not one of these signs is definitive indicators on their own, but when observed in our patients, they should be prompted consideration that low health literacy might be a barrier to their care, such as frequently missed treatments. Frequently missed treatments can be a red flag. It may suggest that the patient struggles with reading or comprehending an appointment slip, or that they lack an organizational system at home to remember and manage appointments. Incomplete registration forms. Incomplete or incorrectly filled out registration forms can indicate low health literacy. These forms can be overly complicated for some individuals, making it challenging for them to provide the required information accurately. Noncompliance with medication therapy. Medication noncompliance is a common challenge, and it is critical to approach it with empathy. Some patients may not take medications correctly, not out of defiance, but because they lack a clear understanding of why medications are important and that they should not and that they should continue taking them after the pill bottles are empty. Additionally, some may not know how to get the medications refilled. Unable to name the medication or explain their purpose of dosing. Patients with low health literacy may struggle to name the medications or explain the purpose and the dosing. This can indicate difficulties in understanding their treatment plans and their prescription instructions. It is essential to approach these indicators with sensitivity and respect, recognizing that low health literacy does not reflect a person's intelligence or overall comprehension abilities. Healthcare providers can take proactive steps to address potential low health literacy by using plain and easily understandable language and communication, incorporating visual aids and interactive education materials into patient education, actively listening to patients' concerns and questions, asking open-ended questions to encourage patient engagement, implementing the teach-back techniques to confirm a patient's understanding and address any misconceptions. By being attuned to these warning signs and employing patient-centered communication strategies, healthcare providers can enhance patient engagement and promote better healthcare outcomes regardless of health literacy levels. Barriers associated with low health literacy. Recognizing the barriers that individuals with low health literacy face is essential for healthcare professionals and organizations. These barriers can significantly impact a patient's ability to access, comprehend, and effectively use the healthcare information, such as limited reading and comprehension skills. Individuals with low health literacy often struggle with reading and comprehending written material and resources, especially those containing complex medical terminology and conditions. Numeracy challenges. Numeracy challenges are common among individuals with low health literacy. Understanding and interpreting numerical information, such as dosages and measurements, can be particularly challenging for them. Language and cultural differences. Language barriers included limited English proficiency and the lack of understanding of cultural norms can hinder effective communication and the comprehension of healthcare information presented to the patient. Limited access to information. Limited access to accurate healthcare information is a significant concern. Some individuals with low health literacy may lack access to the internet and rely on unreliable resources for healthcare information. Stigma and shame. Stigma and shame can lead to reluctancy in seeking clarification or asking questions. Patients may feel embarrassed about their low health literacy and may be hesitant to admit their difficulties. Digital inequalities. Digital inequalities such as is a growing concern. Patients with low health literacy may have limited computer skills, lack internet access, and struggle to understand digital platforms, which can hinder their ability to access online health resources. And social determinants of health. Social determinants of health play a significant role in health literacy. Patients facing social factors that negatively impact their health literacy, such as access to quality education, low socioeconomic status, limited healthcare access, and lack of social supports, are at a distinct disadvantage. Like I've said before, understanding these barriers is paramount for healthcare workers and organizations to develop effective strategies that promote health literacy. These strategies include using plain, easy, understandable language in all healthcare interactions, providing visual aids and supplementary materials to reinforce verbal information, offering language support services such as interpreters and translated materials, utilizing health education approaches that are culturally sensitive and tailored to the individuals with low health literacy, addressing social determinants of health through targeted interventions and community partnership. By proactively addressing these barriers, healthcare providers and organizations can empower individuals with low health literacy to better understand and manage their health. We're going to take a look at strategies to mitigate those barriers and how to provide a universal approach using health literacy. Delivering care and structuring this delivery of care as if everybody has some kind of health literacy. You cannot tell someone's literacy level by looking at them. A person may present themselves, speak well, and appear to understand what's going on. This does not mean that they truly do. It is best to approach care with the understanding that even those who are well educated may still struggle with health related information. The language used in the health field is not commonly used in everyday language, and even those with good educational backgrounds may not understand what their diagnosis means or what's being asked of them. At the end of the day, it is best to use simple, clear language to avoid any opportunities for any kinds of misunderstandings. Strategies to mitigate those barriers, tips for healthcare workers. Here are 7 tips for all of us when working with our patients. As I've stated in the past, use plain language. Think about how we can explain things to a cashier at a grocery store. Limit key points to no more than 3 to 5. Keep the key points concise, ideally between 3 to 5. Focus on what is most critical for the patient to remember and act upon. Overloading the patient with information can hinder comprehension. Be specific and concrete, not general. Provide specific detailed instructions rather than general ones. If a patient needs to take a specific action, walk them through each step clearly. Demonstrate actions and draw pictures. Use models if you have them. Repeat and summarize the information. Most of us don't remember when we are told something once. Recognize that repetition is key to retention. Patients often need to hear information multiple times to remember it. Repeat key points and summarize the information to reinforce learning. The use of the teach-back method to confirm understanding and to help patients move the information into long-term memory. By employing the teach-back method to confirm the patient's understanding, encouraging the patient to explain the information in their own words, which not only confirms comprehension but also helps move the information along. Lastly, be positive, hopeful, and empowering. Patients rely on the healthcare workers to navigate the complexities of healthcare system. Maintain a positive and hopeful attitude and empower patients by providing them with the knowledge and the tools they need to actively participate in their healthcare decisions. By following these tips, healthcare workers can enhance their communication skills, bridging the gap created by low health literacy and empowering patients to take control of their health and their well-being. Strategies to mitigate those barriers. Mitigating these barriers associated with low health literacy require a thoughtful and patient-centered approach. Beyond employing the teach-back method, healthcare providers should consider the following strategies. Organize patient education. Effective patient education goes beyond simply providing written material. Patients often prefer to receive key messages directly from their physician or healthcare provider by accompanying pamphlets and visual aids. Think of these materials as facilitators of the conversation rather than replacements. Focus on the need to know and the need to do. When designing messages for patients, prioritize the need to know and the need to do information. Avoid overwhelming patients with extraneous details such as complex pathophysiology. Instead, concentrate what is essential for the patient to understand and what actions they need to take to manage their health effectively. Minimal information. Recognizing that patients with low health literacy may have difficulty processing excessive information. Therefore, limiting the information provided to what is directly relevant to the patient's condition and treatment. Avoid overwhelming them with medical jargon or irrelevant details. Promote patient engagement. Patients with low health literacy often ask fewer questions. It is critical for the healthcare provider to take an active role in facilitating communication, encouraging patients to express their concerns and questions and assess their level of understanding regularly, ensuring that the patient feels comfortable seeking clarification when needed. Plain language communication. Again, using plain and easy, understandable language when communicating with patients. Avoid medical jargon and complex terminology. Ensure that all healthcare team members, including the physicians and the nurses, adopt this approach and maintain consistency. Interactive education. Engage patients in interactive education. Encourage them to actively participate in discussions about their health, treatment plans, and goals. Interactive methods such as role playing or interactive visual aids can enhance patient comprehension. Accompanying conversations with written material. While written material can be valuable, they are most effective when they are used to support and reinforce a conversation with the patient. Physicians and healthcare providers should also consider pamphlets as other resources and tools to facilitate a dialogue and to enhance the patient's understanding. Encourage questions and clarification. Create an open and welcoming environment for questions and clarifications. Patients should feel comfortable asking for further information or repeating instructions if necessary. By adopting these strategies, healthcare providers can bridge the gap created by low health literacy, enhancing patient understanding and empowering individuals to take a more active role in their healthcare management. Here are some examples of using plain language. Instead of using annual, use the word yearly. Instead of using arthritis, use pain in the joints. Instead of using cardiovascular, use heart. Instead of using dermatologist, try skin doctor. Diabetes, I would use sugar levels in the blood. Hypotension, low blood pressure. And instead of using hypertension, I would use high blood pressure. By using these strategies to mitigate the barriers, we're teaching patients to reduce hospitalization and ER visits. We're empowering patients with knowledge and skills to make informed decisions about their care. Patients will play a more active role in managing their health and seeking care when needed, which will result in a reduction of unnecessary healthcare utilization and it will improve outcomes. So for the last portion of this continuing education course, we are going to review facility activities that we can do to reduce hospitalization and emergency room visits. We're going to figure out ways that we can engage our patients and ways we can engage the staff. Signs and symptoms, education, and teaching. Below you will see a picture of a bulletin board that was put in a Network 9 lobby. And this bulletin board is to have patients come in and see, based on a variety of signs or symptoms that they may have, what kind of care they may need. The key features of this bulletin board is that patients can quickly locate essential information about where to seek care based on their signs and symptoms. There's clear directions. The board presents 3 primary destinations, as in a walk-in clinic, an urgent care, or an emergency room, accompanied by a list of various signs and symptoms that the patient may be experiencing. Patient-friendly education. In addition to the clear directions, they have provided patient-facing education materials. These materials are designated for the patient to take home with them, ensuring they have access to the valuable information beyond each visit when coming into the lobby. This bulletin board exemplifies their dedication to their patient care and education, offering easily accessible resources to enhance patient experiences and outcomes. I feel this board is very great as to every time the patient comes in, if they're feeling something some kind of way, they can come in and take a look at what signs and symptoms they're having, and they can discuss this actually with their nurse or their social worker or their technician putting them on, and it can facilitate a conversation on what kind of care they need based on what signs and symptoms they may be having. After witnessing the impressive work done on their bulletin board, I was inspired to broaden our approach to patient education. We understand that not all patients retain information the same way. The network took the initiative to create a versatile resource that encompasses a wide range of signs and symptoms and medical conditions that patients may experience at any given time. This resource offers clear guidance on the type of medical attention the patient should seek based on the specific signs and symptoms or condition. Furthermore, it emphasizes the importance of immediate action. If a patient is unsure about their situations, patients are encouraged to contact their dialysis center during operation hours for guidance, or if in doubt, they can dial 911 for emergency assistance. This resource represents our commitment to comprehensive patient education and ensuring that patients have access to the information they need to make informed decisions about their health and their well-being. We also took care to include detailed descriptions for certain signs and symptoms or conditions to ensure that the patients have a thorough understanding of their health concern. This additional information enhances patient knowledge and supports informed decision making regarding their medical needs. After establishing the resource, we recognize the importance of engaging both staff and patients in a fun, interactive facility activity. We will discuss how this engagement will be facilitated and share ideas on how other facilities can implement similar initiatives. Engaging staff and patients. We understand that interactive activities can make the learning experience more enjoyable and memorable for both the staff and the patient. To achieve this, we have planned the following. We went through and we did a workshop where we organized interactive activities where the staff and the patient can participate in hands-on activities related to their healthcare education. These workshops will encourage activity participation and provide opportunities for questions and discussion. And that is what we're going to be focusing on in the next couple of slides. You can also do games and quizzes. We will incorporate games and quizzes into educational sessions. This approach can make learning fun and competitive, motivating participants to absorb and retain information. You can also do role playing. Role-playing exercises can be used to stimulate real-life healthcare scenarios. Staff and patients can actively engage in these scenarios, improving their understanding of how to respond to different situations. And also group discussions. Group discussions can be encouraged to foster open communication and the exchange of ideas. This collaboration approach can lead to a deeper understanding of healthcare topics. What the educator will provide to the patient. By providing a fun and engaging way to educate both staff and patients, we aim to enhance healthcare literacy and improve the overall quality of care. We are excited to share our approach with others and contribute to the broader healthcare community's efforts to empowering patients and the healthcare professionals through interactive education. The educator will provide a comprehensive education to the patient covering common signs and symptoms associated with various health conditions. This education will be delivered using clear and understandable language supported by visual aids and real-life examples. Patients will be taught to recognize red flags that could indicate a medical emergency, ensuring that they are aware of and when to immediately find action. The patient will receive education on different levels of care available, including an explanation, the distinctions between primary care, urgent care, and emergency room. Additionally, the educator will teach the patient a decision-making framework to assist them in making informed choices about their health care. Communication will be encouraged, and patients will learn how to effectively describe any signs or symptoms they may be experiencing, facilitating better interactions with healthcare providers. The educator will provide resources and tools that summarize key information, allowing patients to reference important details after the teaching session. To ensure an understanding and retention, reinforcement and follow-up can be conducted, providing additional support as needed to address any questions or concerns the patient may have. On this slide, you are going to see the instructions for the facility interactive activity. I will go into a little bit more details and other ways that you can make this activity fun and enjoyable for not only the patient, but for the staff as well. In our ongoing commitment to improving healthcare decision-making for both the staff and the patient, we are designed an interactive activity that utilizes the valuable resource provided by the network titled, What Type of Care Do I Need? Additionally, we will be using cutout flashcards, and there is an option for a bulletin board interactive activity as well. Components of the interactive activity. Resource distribution. The first step involves distributing the network's resources. What type of care do I need? To both our dedicated staff and our valued patients. This resource serves as a foundational guide for understanding various healthcare pathways. Flashcards for the staff. To facilitate an interactive discussion, our facilities department will provide staff members with cutout flashcards. Each flashcard represents a different medical condition, sign, or symptom found within the network's resource. We're going to initiate a conversation. During or before the patient's treatment session, your trained staff will offer patients one of these flashcards, sparking a meaningful conversation about the patient's potential care pathway based on the selected flashcard. This dialogue encourages active patient participation and empowers them to consider their healthcare options. Resource alignment. Staff members will also use the network's resource to assess if the patient's chosen care path aligns with the recommendations outlined within the resource. This step ensures that patients receive accurate and reliable guidance. Educational opportunities. If it becomes evident that the patient's choice does not align with the recommended care pathway, this presents a valuable educational opportunity. This relevant staff member can then engage into an informative session with the patient, addressing any misconceptions or concerns and guiding them towards a more suitable care options. Promoting effective communication. The primary goal of this interactive activity is to promote open and effective communication between our staff and our patients. By offering patients the opportunity to actively engage in the discussion about their healthcare needs, we aim to identify and address any potential barriers that they may encounter in assessing the appropriate care. Through these interactive dialogues, we are empowering our patients to make informed decisions about their health care, fostering a collaborative and patient-centered approach within our facility. So I'm going to give an example of how I would personally work the interactive activity within my facility. I would print off the what type of care do I need resource that was provided by the network. I would distribute it to my staff members and explain to them how we were going to facilitate this activity. Next, I would make print-offs of that resource and provide it to the patients. I would have my administrative assistant or my dietitian, my social worker, my facility administrator take the flashcards that were provided by the network and cut them out and give one to each patient prior to them coming into treatment. The patient would be given the flashcard and they would sit down to get ready to be placed onto the dialysis machine. The staff member would ask the patient what condition they got, and then that would facilitate the conversation as to what kind of care would you need based on this sign or symptom and condition. The staff member would be able to have that resource available to them to find out if the patient was on the right track based on what they were given for the day for their flashcard. If the patient is not on the right track of what type of care they need, an appropriate staff member can intervene and have a conversation with that patient, trying to find out any barriers that patient may have as to why they're not picking the appropriate care that they need. There also is the optional bulletin board. While it's not a mandatory component for this activity, facilities have the option to enhance the visibility by incorporating the informational bulletin board. This board can display key messages and resources related to the health decision making, further supporting our mission to improve health literacy among patients and staff. Just as the couple slides prior to that, I showed the one that Network 9 provided in a lobby, the facilities could do that as well. They could also provide a bulletin board that had a red, yellow, and green colors on it, and the patients, once they have their flashcard at the end of treatment and they've made the right decision, they could take their flashcard and put it in the appropriate box, having red be an ER visit, yellow being an urgent care visit, and green being the primary care physician visit. The following resources were used for this presentation. In conclusion, health literacy is not just a concept. It is a powerful tool that we, as healthcare professionals in the dialysis field, wield daily to transform lives. It's our compass for navigating complex healthcare landscapes, a bridge to connect with our patients, and it is the key to unlocking better health outcomes. By campaigning health literacy, we empower our patients to take charge of their well-being, ensuring they understand their treatment options and enable them to make informed decisions. As nurses, dietitians, social workers, and patient care technicians, we play pivotal roles in this journey. Through our dedication and our expertise in compassionate care, we enhance health literacy and in turn elevate the quality of care we provide. We bridge gaps, decipher myths, and we build trust. In this dynamic field, where every interaction counts, let us remember the profound impact of health literacy on our patients' lives. By advancing health literacy with our team and among those we serve, we are not only improving patient outcomes, but we are also strengthening our healthcare community.